Hello everyone, in this video we are going to discuss the NADA's criteria. As you would be knowing that NADA's criteria is for the assessment of presence of heart diseases. So if a newborn is having heart disease or not, for that assessment use the NADA's criteria and mainly the congenital heart diseases. Right. So there are as obvious major and minor criteria, and if there is a presence of one major criteria or two minor criteria, so that can be labeled as the heart disease. So the major criteria mainly are the systolic murmur of grade 3 or more. So if there is a systolic murmur of grade 3 or more, it's a major criteria. Any kind of diastolic murmur is present, cyanosis, mainly central cyanosis, okay, and the presence of congestive cardiac failure. So these are the major criteria in the NADAs. And if you talk about the minor, so it is systolic murmur grade of 1 or 2, or there are any abnormal heart sound, or there is an abnormal ECG, abnormal X-ray, or the presence of abnormal BP, blood pressure. So these are minor criteria and major are these. Now let's discuss something more about systolic murmurs as we have seen in this. So if systolic murmur is more than grade 3, so there can be two. There are pansystolic murmur or it can be ejection systolic. Pansystolic, if we talk about, so pansystolic is usually always pathological. Okay, pansystolic murmur is present. Okay, so it always is pathological. What do we mean by pansystolic? It means that if we see this is S1 and S2, okay, first heart sound and second heart sound, so the murmur is present all over the systole happening between the S1 and S2. All over the murmur is present, that is pansystolic. Now there are three mainly pansystolic which are in the VSD, that is ventricular septal defect, mitral regurgitation and tricuspid regurgitation. We would be knowing what is VSD. VSD is that if the blood is going from the left ventricle towards the right ventricle. Mitral regurgitation is from the left ventricle, it is going back to the left atrium, right? And the tricuspid regurgitation is that if the blood is going from right ventricle towards the right atrium. So this was pansystolic. Now if you talk about the ejection systolics are also short in, like if there is an anemia or high fever present, so we can hear the ejection systolic murmur. And if we talk about the pathological view, pathological and aortic stenosis, we can find the ejection systolic. A little bit about cyanosis. Cyanosis, as you would be knowing, it is of central type and the peripheral type. Mainly is for central, if the oxygen saturation is less than 85%, then only it's a criteria for heart diseases. So central, mainly it is present in the extremities like finger, toes, as well as the mucous membrane of mouth and tongue. Whereas in peripheral, it is not present in the mucous membrane. That's a major difference. Now if you talk about the consequences of central cyanosis, it is mainly if there is an unoxygenated blood and there is a shunt from right to left. So if there is a shunt from right to left, and this shows the presence of heart disease, or there is an obstruction, that is blood is not fully oxygenated in the lungs. So these are the causes of central cyanosis. And peripheral is mainly there is an increased O2 extraction from blood by tissue. So if we have to talk about the presence of heart disease, so it will be the shunt from right to left. Mainly these will be the causes of cyanosis. So this was all about NADA's criteria. Thank you for watching.